On this video, I'm going to demonstrate the psoas technique. That actually involves two muscles that flex the hip. One being the psoas major that originates right here on the lumbar spine, and the other being the iliacus that originates right over here on the hip bone. Both of these two muscles cross over the viscera and into the lesser trochanter of the femur bone or the thigh bone. Now, if this muscle is tight, it can cause a couple of problems. Number one, what can happen is the femoral head, which is the thigh bone here, can pull into this socket here. And what can happen is you wind up with an adhesion, which basically means you're taking Delmer's glue and putting it in there, and you have a limited range of motion. Another thing that can happen is because if it's tight on this side, this muscle here called the quadratus lumborum can overstretch. And what you have then is an imbalance. Another thing that can happen is because of this imbalance, you can wind up with a tight piriformis right here that can compress against the sciatic nerve, and you wind up with sciatica, which is a pain that radiates all the way down the leg into the heel. So in order to test the range of motion, what we're going to do here is we look for range of motion. So the normal range of motion is between 35 and 45 degrees. If this is restricted, it means that it's not releasing. So if we have a limited range of motion, it's not going to be releasing. So here I have Tom on the table, and Tom, why don't you pick up your right and see how high you get. Okay, here we see, go ahead, set down. Here we clearly see, and I'm going to get it, and we can clearly see we might have maybe about 5 to 20, maybe about 15 degrees range of motion. Now we're going to check the left. I'm going to pick that up. Go ahead, Tom, pick it up. That's more normal. That's better. So this indicates to me that on the right side what's happening is the psoas and the iliacus are tight.